Hi, my name is Joseph from Mental Health Europe, and today we're going to be discussing psychiatric diagnosis, what it is, how they're determined, and what your options are should you receive one. In general, a physical medical diagnosis is the process of determining which disease or condition explains the symptoms and signs you're experiencing. During this diagnosis, a medical professional will typically gather information from your medical history and a physical examination. A psychiatric diagnosis, on the other hand, is quite different, as there are often no physical symptoms, nor are there any biological tests that we can conduct to conclusively determine types of mental distress. Although these tests can be important to rule out any underlying physical causes, health professionals making a psychiatric diagnosis will have to rely on your own description of thoughts and feelings alongside observations of your behavior. In this sense, it is often said that the person best placed to make a diagnosis is yourself, supported of course by information and empowered discussions with healthcare professionals. The main purposes of current psychiatric diagnoses are to help health professionals communicate with each other and to determine which forms of treatment would potentially be best to prescribe to you. You might find receiving a diagnosis helpful and reassuring. You might also, however, find it to be stigmatizing. A diagnosis can be a way of recognizing and recording your distress and open doors to obtaining help, but it can also lead you to think that your distress comes about as a result of illness. For some, this might be a helpful way of seeing things, but it is not the only way to make sense of psychological distress. Both psychiatric diagnosis and its associated treatments have recently come under a greater deal of scrutiny, with many psychiatric diagnoses leading to the prescription of medications. Though these medications can bring you temporary relief, they can also have unpleasant or debilitating effects. If these occur, it is very important to discuss them with a doctor. Psychiatric medications can also be addictive. Stopping them can be very unpleasant, may lead to the original thoughts and feelings returning in a worse form, and is potentially dangerous if not done with a professional support. If you are interested in discovering more about psychiatric medication, you can check out our video on the subject on our YouTube channel. Anyone experiencing mental distress has the right to be, and must be, meaningfully involved at every stage of a medical assessment and a potential treatment. You should participate throughout the decision-making process, discussing and agreeing on the best course of action for you. Despite common belief to the contrary, scientists have actually yet to discover any genetic markers, chemical imbalances, or other differences in brain function which reliably predict or identify mental illness. Clearly, there are genetic differences which impact on the way we respond to life events, and distressing experiences can produce consequences in the chemistry of our brains. But this is not at all the same as suggesting that brain diseases cause mental illnesses. Moreover, we do not yet fully understand how brain chemistry is related to distress, and it is therefore difficult to see how we might be able to use this to help people. Despite common belief to the contrary, scientists have yet to discover any genetic markers, chemical imbalances, or other differences in brain function which reliably predict or identify mental illness. There are two main sources for the current diagnostic model: the International Classification of Diseases and Related Health Problems, or the ICD, produced by the World Health Organization, and the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, produced by the American Psychiatric Association. Both have a long history and are constantly being revised. So what is the difference between the ICD and the DSM? The World Health Organization's ICD covers all diseases and conditions, whereas the American Psychiatric Association's DSM only covers so-called mental disorders. Both accept that different forms of mental distress can be categorized as medical disorders. In practice, the DSM is used by American physicians and by researchers, whereas the ICD is used more in Europe and is sometimes preferred by clinicians as being more practical. However, both are used worldwide and together form the main lens through which mental distress is viewed, the so-called biomedical model of mental illness. Both are also used extensively in insurance-based healthcare systems to establish entitlement to treatment and disability pensions. This often means for many that no diagnoses means no treatment nor disability pension. So how are the diagnostic manuals compiled? Because there are no defining physical or biological markers or tests for mental health difficulties, the manuals rely on the collective opinions of panels of experts who decide how to describe different forms of distress. They compile lists of thoughts, feelings, and behaviors which fit the illness they have named and described. These lists, in medical terminology, are described as symptoms. In reality, all of the symptoms are also experienced by people who are not described as mentally ill, and for whom the impact on their lives may be temporary or unproblematic. Why are they being constantly revised? The continual revision of the manuals is perhaps reassuring, in that it aims to continue to improve practice, but it also reminds us that these diagnoses, at best, reflect how we see things today, in today's society. Experts are continually changing their minds, both about which forms of distress to include, and about how to describe the differences between illnesses. A lot of diagnoses are in fact moral judgments reflecting changes to societal values and preoccupations, rather than scientific progress. What are the criticisms of the ICD and DSM manuals? Critics of the diagnostic approach to mental health problems point to several issues. The constant debate about what to include as diagnostic criteria indicates the difficulty in deciding what is normal human reaction to distress and circumstances or experiences, and what is abnormal or a sign of illness. Symptoms are often overlapping between diagnoses, and therefore distinctions between different conditions are unreliable. This can lead to a person receiving a number of different diagnoses, which can be confusing and unsettling. Focusing too much on an illness and a medical perspective can act as a distraction from other important factors responsible for mental distress, such as social and cultural issues. Are there any other ways of thinking and talking about mental distress? Well, many people, including psychologists and some doctors, are questioning the value of the biomedical model in supporting mental health. This is not in any way to minimize the pain or disruption to people's lives, but rather to take a less narrow and one-size-fits-all view of mental distress. Instead of deciding on a medical diagnosis, alternatives can be discussed between yourself and your health professionals. Rather than asking, what is wrong with this person? Clinicians are increasingly giving voice to the question, what has happened to this individual that they have been unable to cope with? This kind of approach, they argue, leads to more personalized help, and means that you are more involved and in charge of your own care. The solutions are more individualized and should be based on your will and preferences, as well as your informed consent. They may include short courses of medication to bring relief, but the objective is always about finding what works for you to recover and rebuild the life you want to lead. They also take into account the fact that we are social beings and that our mental health relies on the relationships and the communities in which we live. Many people who have received a diagnosis find it helpful to consult others with similar experiences. There are many organizations led by people with lived experience of mental distress, which offer support, advice, and who also campaign for better policies in the healthcare and legal systems. Some are mainly concerned with particular forms of distress, such as the Hearing Voices Network, while others represent persons with lived experience who want to improve the way people in mental distress are treated. For example, the European Network of Users and Survivors of Psychiatry. You can find a full list of our members per country on our website. Always talk to your health professional. The process of diagnosis and treatment should be a collaboration, process of discovery in which your own opinions of what has happened are understood and taken seriously. Your preferences regarding treatment are respected. If treatment is clearly not working for you, say so and ask for changes. Although sometimes difficult, it may be necessary to consult several professionals before finding the right one for you. If a health professional tells you that the illness they have diagnosed you with will be with you for life, or that you will never work again, or anything to that effect, seek a second opinion immediately. Always remember that at the end of the day, the choice is always yours. If you or someone you know may need more information, you can visit our website to discover our short guides and other useful resources at mentalhealtheurope.org. You can also check out our other videos on our YouTube channel. Be sure to subscribe to follow along for more mental health information from a non-stigmatized point of view.